comprehensive assessment of your client is critical to planning appropriate nursing care and is an important function of the registered nurse. An initial assessment is done when the client presents to the healthcare system and is used to establish a baseline of the client's status and functional abilities. It is used to develop the care plan designed to help the patient. Part of the comprehensive nursing assessment is a physical assessment. This program focuses on the beginning skills you will need to assess your client. Throughout your educational experience, you will learn additional, more advanced skills, but they all use 4 foundational methods: inspection, palpation, percussion, auscultation.
When you arrive at the facility, the first thing you want to do is when you're assigned your patient is you want to go in and you want to introduce yourself to your patient. You also want to explain the procedure. Now, it's best to say, I'm going to, again, just check you over a little bit, because some of them may not know what a head-to-toe assessment is. So go ahead and explain it. Just say, I'm going to listen to your chest a little bit and just check you over. The first thing that you want to do is you want to take the vital signs. And the reason you always want to take your vital signs is because you want to get the baseline for that patient. Then if those go up or down, that way you'll know what it was when they were admitted to the facility. Your patient should be wearing a gown or a loose-fitting shirt on top, so that when you auscultate the lungs, you'll be able to actually put the stethoscope next to the skin. That is very important. Now again, you want to use all of your senses as you gather the data. You want to hear what the patient has to tell you. You want to see what the patient looks like. You want to smell, are there any odors that should not be there? And you want to feel when you palpate. Get all of your equipment together before you go into the room. You're going to need, of course, your stethoscope for auscultation. You will need your pen light, and this is going to be for your checking the pupils. It's nice to have a little ruler because you can check with centimeters and you can measure their scars. This also has one where you can gauge the size of the pupils, and you can record it as such. And on this side, of course, it has the little circles where you, if you find a decubitus on the patient or a skin breakdown, you can measure that. Again, it's nice if you have your little pocket minder that you can put your equipment in and carry with you, your pencil, your scissors, anything like that. You can just, again, put it right into here. And again, you're going to need a pair of gloves. We're now ready to start with the head. As you inspect the head, you want to look first of all for the hair color, the texture. Is it oily, dry? Is there any seborrhea? Are there any parasites? As you look also on the scalp, you look for scars, lacerations, bumps, growth, again for alopecia. As you come down the head, you look at the eyebrows, the symmetry of them, the amount of hair that they have in them. Do they have hair? Do they have 2 eyebrows? Are there any lacerations through them? When you get to the eyes, you want to look at the lashes. You can check the color. You can check the sclera and make sure that it's white. The conjunctiva you can check by doing this and make sure that it's pink. Check and make sure that the pupils are equal and reactive to light. And as you put the light into one eye, both eyes should react. Can you move it this way, down, here, back, and up? Does the client wear glasses or contacts? As you move down the face, you want to check the nose. Again, the shape of the nose. Is there, you can look up in it and make sure that it's nice and clean. Ask the patient to put a finger on each side. Good. And that will check for patency of the nose, of the nares. On the ears, when you move to the ears, first of all, where do they sit in accordance to the eyes? They should be clean. There may be some wax, but you never want blood, any clear or purulent exudate coming from the ears. Does this patient wear a hearing aid, and do they have them on at the time? As you come down to the mouth, you want to check for the color of the mucous membranes. You want to check the uvula, the tonsils. Are there any caries? Are there any missing teeth? Is there any halitosis, bad breath? Is the tongue midline? Stick your tongue out and move it back and forth. Good. And then when you get to the neck, again, you might want to check the carotid at this time. You check one side and then you check the other on your carotid. You want to do some range of motion at this time. So again, let's rotate the head back and forth. And is it active range of motion where the patient can move it themselves, or do you have to help them do it? Okay? And again, don't extend the head this way. It's better to put it down this way and see if they can touch the chin on the chest. This is another time that you might want to check the turgor. Since you're right here, oops, the turgor, and you want to check that. A good place on an adult is right in this area. And again, you want to check it for elasticity to see if there's any dehydration there. We're now ready for the thorax. Again, on the use of the stethoscope, make sure when you put your stethoscope in your ears that the earplugs are forward, so that when you put this in, it will fit snugly there. Check it here on your diaphragm. When you start in the back, you want to access all the places. You want to start here and ask the patient to breathe in and out through their mouth. Here. Then you go down and do your movement through the various spots. This is also a time that you can view the spine. Is there any kyphosis? Is there any scoliosis that you notice in the spine? Now we do note here that we have a scar from a previous surgery. And this is where we can use our little measurement. And that's about a 5-centimeter scar. Let's draw this. While you have the patient still sitting up, you want to, again, check the lungs, have them breathe in and out through their mouth. You're ready now to check the heart. And again, you want to check your 5 points that your book tells you about, and you want to use the bell. If you turn the bell on your stethoscope, you should be able to, until it clicks into place, you should be able to hear very well with the bell. To find the aortic, the pulmonic, the second pulmonic, the tricuspid, and the mitral valve. We're now ready for the abdomen. When you auscultate the abdomen, you want to divide it first of all into 4 quadrants. So you will have the right lower quadrant, the right upper, the left upper, and the left lower. And you just divide it where the umbilicus is here. You want to begin the auscultation of the abdomen in the right lower quadrant, which is the area of the ileocecal valve. And that's probably where you will be able to hear something first if there's any movement on the valve. So again, you listen there, you move up, you move over, and then you go down. After you've auscultated first, then you can go back and lightly palpate areas that you feel like, again, you should be feeling for. And at first you're not going to know exactly what you're feeling for, and it may be very normal, but once the abnormality comes in, you will be able to know, be able to come to feel that. We want to check the arms. You might want to check your brachial pulse if you can feel that. Again, you've done the radial pulse at least on one side because you've gotten vital signs on this patient. And you always want to do your pulses bilaterally. Feel them on both sides. The skin color of the arms. Are there any scars? Are there any tattoos? The hair, again, is there hair on it? Is the skin dry? Is it warm? Is it intact? And this is where you can also do your capillary refill while you're right here. And just reach over and ask your patient to do a grip, a hand grip for you, and make sure that those are both adequate and both balanced grips. As we go on down, we're going to defer the perineum until bath time, but now we're ready to check on the legs. As you move down the body, you want to, again, palpate the pulses as you go down. The femoral pulse is going to be in this area. You want to palpate that bilaterally. You want to go to the popliteal, and again, sometimes this one is very difficult to find and to feel, but it helps a little bit if you hold the leg up to this angle. You want to go down and you want to find your posterior tibial, and you want to find the dorsalis pedis. While you're there, you might want to do the Hohmann sign. And this again, if you bend the leg just a little bit and you pull forward, if you elicit any, if there's any pain that the patient complains of at that time, it could possibly mean that they have some type of blood clot there. Again, other than the Hohmann sign, you want to look at, does the patient have hair on their legs? And with some of your older patients, during the, when they get older, they will have very shiny legs. There will not be any hair on it. And this is indicative of some problems. It could be peripheral vascular disease, and you would know that that's going on with them. Again, what's the color of the skin? Are there any scars? Is there any edema? And again, you're checking for your edema. You want to check, try not to push right in the area of the bone, but rather try to pick it in an area where you're not pressing right against the bone. And again, you want to measure that in 1+, 2+, 3+, or 4+ for however long or however deep you do your indention. To check pain and pressure perception and evaluate nerve function, a 10-gauge nylon filament tool may be used. You need to ask your client as you use it if they can feel when you touch the places on their foot.
Yes. 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 Yes.
It will assess the diabetic patient for moderate to severe neuropathy. Observe the client as they ambulate. Note the upright posture. There is no shuffling of the feet. Balance is adequate. If your client uses an aid, such as a walker or cane, observe the mobility and the correct usage of that aid. As you leave the room, think of safety issues. Make sure the bed is in the lowest position. Make sure that the side rails are up and the call light is within reach. This video has presented the beginning skills you need to do a baseline physical assessment. Throughout your educational experience and professional life, you will learn additional skills that will allow you to do more in-depth and focused assessments.